Hi, this is Chris, and we are going to talk about analyzing 12-lead electrocardiograms. Today, we are going to focus on contiguous leads and the criteria for calling a STEMI alert or cardiac alert. So remember, STEMI stands for ST segment elevation myocardial infarction. I will also be showing you a trick or a tool to help you remember what artery might be associated with the heart attack that your patient is having. So let's start off with the inferior portion of the heart, color-coded in green on the chart. That's figure 11.6 from your textbook. And you have two images here of a heart model, one with just the model and the other one with my hand. The first two fingers and thumb are wrapped over the heart, and they are specifically you're going to use this tool to identify the area of the heart that might be having the infarction and the associated artery that might be involved. All right, so this could be helpful with test questions or just for your general knowledge to help you understand what area of the heart is actually becoming necrotic due to a lack of blood flow. So if a person is having an inferior infarction, it is likely involving the right coronary artery, and you're going to see ST segment elevation in leads 2, 3, and AVF, or at least two of those. Moving on to the septal and anterior regions of the heart. So you have two regions of the heart that are fed by the left anterior descending artery, the LAD. And in this case, that is identified by the index finger. So if you see ST segment elevation in leads V1 and V2, or ST segment elevation in leads V3 and V4, you meet criteria for those respective regions. You might see ST segment elevation in all four of those. In that case, you would identify that heart attack as septal anterior myocardial infarction. Moving on to the lateral portion of the heart, you can see I've taken the model and turned it sideways, and the thumb is wrapped around the circumflex branch in this case. So when the blood comes into the coronary arteries, it comes into that left coronary artery, and that left coronary artery branches into the left anterior descending and the circumflex branch. So if we are seeing ST segment elevation in leads V5, V6, 1, or AVL, or any two of those four, then you meet criteria for calling a lateral myocardial infarction. Right? Be systematic. When you're analyzing these 12 leads, your priority is to identify if the patient is having a heart attack. I'm going to show you a handful of other things to look for, but this is really the main thing. So you want to be systematic, and you want to use the same technique every single time. For example, there's a couple of acronyms that are introduced in the book. One is I see all leads, and the other one is SALLY. So with I see all leads, you're going to start with inferior, go to septal, go to anterior, and then go to lateral. If you're using SALLY, then you would start with the septal regions, go to anterior, go to lateral, and go to inferior, and do it the same way every time. This will help you to treat your patient quicker, get them to the hospital quicker, and keep that door to balloon time is what is referred to in the books often. What we were trying to do is to limit the amount of damage done to the heart, get that person to the hospital, and get them definitive treatment, which is often placement of a stent in the artery that has the clot. All right, hope that makes sense. The way that you're going to get good at this is to practice, practice, practice. All right, I'll see you in the next video.